Our next slide here shows some strokes, and the medical term for strokes are cerebrovascular accidents. And there's a few different strokes I wanted to show you here. The first of which is an ischemic stroke. So this has to do with a lack of oxygen. It's caused when blood circulation to the brain, which is called ischemia. So the word ischemia itself means lack of oxygen, specifically to a tissue. So in a heart attack, ischemia could happen to the myocardial tissue as well. So in the case of an ischemic stroke, the brain tissue dies, and that's called necrosis. And a couple examples of this are thrombotic, where there's a blood clot, and embolytic, where the clot travels. So let's look at our image on the right here. We have a typical carotid artery. The carotid artery is the one that's going to be going up your neck. You can feel your pulse there really easily. But if we have a diseased carotid artery, and this diseased carotid artery could be due to something like atherosclerosis. And atherosclerosis is the buildup of plaque formation, which is going to make the diameter essentially of the carotid less. A lot of times when you go to the doctor, they'll put a stethoscope on your carotid artery to listen to what they call carotid bruits, which is essentially buildup of atherosclerotic plaque that could occur at the carotid artery, meaning you could have a risk of a stroke. So in this case, the blood clot is going to break off and travel. The clot itself is called a thrombus, but when it travels, it's called an embolus. The blood clot lodges in a cerebral artery, and at that point, that area is now deprived of oxygen. And that deprivation of oxygen is called ischemia. So hopefully they've caught this incident early enough that they can correct it surgically. Another example of a stroke is called a hemorrhagic stroke. This is when a blood vessel in the brain actually breaks and bleeds. It's very, very serious. It could include intracerebral hemorrhage and subarachnoid hemorrhage. Mini strokes that you've heard of, they're commonly referred to as mini strokes. They are also called TIAs, which means transient ischemic attacks. And these are temporary episodes of reversible cerebral ischemia that usually lasts less than 5 minutes. And mini strokes are very common as people start to age. Some degenerative diseases are shown on this slide. The first of which is Alzheimer's disease. And Alzheimer's disease is a progressive degenerative disease of the brain that results in dementia. And there's various types of dementia as well, but when they look at an Alzheimer's brain, which is what you are seeing here at the bottom of your screen, you're seeing a large area which does not light up at all. So these are both PET scans. And the two main things that are seen in Alzheimer's brain are what are called amyloid plaques and a type of protein called a tau protein and neurofibrillary tangles, which means the neurons, especially the processes, are all kind of tied up. The next one is called Parkinson's disease, which is shown on the top of the slide. We see a normal brain on the left and a Parkinson brain on the right. You can see the area here, which should appear red. It doesn't. So Parkinson's disease is a degeneration of the substantia nigra, and it's the lack of dopamine that results in too little movement. So I would definitely recommend an amazing movie if you haven't already seen it. It's actually on Netflix right now, and it's called Awakenings. It's based on a true story. It's got some real stars in it, like Robert De Niro and Robin Williams. And basically what happened is there was this what's called an encephalitis problem that began in the 20s or so, and these people went to sleep for decades, and they suddenly woke up when this physician, who is played by Robin Williams, starts to give them dopamine. So they call it L-Dopa, but the dopamine is a miraculous drug that wakes them up for a certain period of time. So it's quite a miracle. It's an amazing movie that you really should watch if you're able to. But and you can also get it from the library too. So even if you don't have Netflix, it's easy to get. But again, this is the Parkinson's PET scan. Another brain disorder is Huntington's disease. Huntington's disease is an unfortunately fatal hereditary disease caused by the accumulation of the mutant protein Huntington that leads to degeneration of basal nuclei, kind of like in Parkinson's, but in this case, it results in too much movement. So the specific name for Huntington's is called Huntington's chorea, and chorea kind of looks like the word choreography. So somebody with Huntington's is going to have too much movement. So they could have jerky, flapping movements. If they were to try to grab a cup of water that maybe was sitting on a table, chances are they would probably knock it off because of too much movement.